This is the Making Waves podcast. My name is Dave Roblin, and we're here with Aaron Levisay. Aaron, welcome.
Thank you, Dave.
Aaron, you've been involved in a lot of stuff. You're kind of a problem solver. You've done things for the social studies standards and convention of states. You strike me as a kind of a problem solver type of guy.
Well, thanks. I mean, I think we all have things that we see that could be better or that have been problems that we've noticed, and you just keep your eyes and ears open, and sometimes you can actually come to something that might actually solve some of these things. You just got to try.
And we're here to talk today about medical cost transparency. How long have you been involved with that?
Roughly the last 2.5 years for an active solution to it for the very non-transparent system that we have in the United States.
I quite understand that. So there's been talk of a medical cost transparency bill in the legislature. There's no bill number yet. But what does that mean?
Well, what it means is if this bill could go through and gets funded, which really isn't not very expensive at all, it would allow the South Dakota citizen, or basically go on a government website and find out what an average cost for an office visit, let's say, in a physician's office, or certain medical and dental procedures without any insurance, and just know what the cost is. Really actually bringing the other side to the economic equation, which is the price.
People would go onto this website and they look up relative costs or stated costs for whatever medical procedure.
And with the doctor or dentist's office, that the claims data redacted so you don't see the person's name, but just basically what the average is for all of those various items.
Has this been done in other states?
This has. That's kind of where I got the idea.
Well, what states?
Okay, well, the main one is in New Hampshire, and this goes way back to 2006. They passed a bill very similar to what we have in South Dakota to basically just make it more transparent, as we're talking about here. And it took them a little while to get all the data and then get it on the site, but it's been a big success there. And so right now you can go to the site and you can look up any of over 200 plus procedures, either medical or dental, in real time, and with the physician or hospital or clinic or office, and where they're located, and just go and say, oh, this is the average cost for an office visit or a tooth filling, or what, and that it's just amazing.
It's called the New Hampshire Medical Cost, and know what you might pay, and we'll have a link to it in our host here. But this is run by the government, and it has all procedures and how much that people might pay on this stuff, so you can get a cost comparison. So what has been the effect of this medical cost transparency in New Hampshire?
Well, it's been amazing. It actually, they had a study done from 2009 to 2019, and they have it on the site itself, that was done out of the University of Michigan. An economist studied it, and although you never say that causation is the same as correlation, but medical costs in New Hampshire went down over a 10-year period, even with an aging population, which normally you wouldn't see that. I think this probably had a lot to do with it because, again, if we know prices, then we can shop. It's a common sense economic thing that we have almost anywhere else in society, but just not in medicine. And we'll historical reasons for that, but we haven't really had a solution to this at the state-by-state levels until now, but it's worked wonders in New Hampshire.
Was there resistance from providers to provide data to this site?
The guy that I talked to, Tyler, he said at first they were, but then when they found out that people were going on the state site, again, totally free, and then seeing their names listed, and then they were getting more and more patients than ever before, and they were like, they would call up the New Hampshire Department of Insurance and say, hey, how come we're not listed? And they have to provide the data and everything like that. So it's funny how that changed when they realized, oh my gosh, they've got more patients than ever before.
Mm-hmm. So it kind of provides advertisement and also transparency for them too, so everybody's happy.
Exactly.
It'd be relatively low cost to run the site.
Oh gosh, yes. It extremely, and the legislators I've talked to know this.
Are there any hospitals in South Dakota that provide medical cost transparency?
Okay, so a little bit of a history lesson here along with that, the answer to that question. So back in January of 2019, then President Trump, I could be president again, but then President Trump first term, put out a huge Health and Human Services nationwide EO that said any hospitals that have any federal funds, which is essentially all of them because they have to take Medicare and Medicaid, payments, must post their most used procedures for the public. Now, since that time, there's been some that have done it, but the majority of hospitals in America, they do and they don't. They basically kind of put it into an algorithmic thing where, yep, you can click on it, and if the average person can understand algorithm mathematical things on their CSV files, Excel files, then sure, they've done it. But the idea was that he was trying to make it so that hospitals would put in dollars and cents like we understand for paying for things. Okay. So as of 2024, a group that studies this and puts out the reports all the time says that about 21% of 1,600 hospitals they surveyed are there. So no, we're not doing very well as a nation. Specifically in South Dakota, because they look at South Dakota, there's one hospital that's meeting all the tenets of what was put through in that EO 6 years ago. And it's a small hospital in Viborg. And again, this is as of November 2024, but basically you can pretty much say that in terms of hospital price transparency in the state of South Dakota, and not just there, but around, but there's basically, it's not very good.
So tell us about the all-payer claims database.
Sure. So after the New Hampshire site was set up, they realized they needed to have an organization ready to help other states essentially collate and manage their insurance data so they could make these other sites. And a lot of other states have done it, Georgia and a bunch of others. So the all-payer claims database council is basically the advisory body that goes around to states after they've passed essentially an APCD bill, which is what I'm talking about, and says, all right, you want to know how to do this? We're the experts. Here's how you do it. Here's how you collate it. Here's how you pull the data. And based upon that, here's how you put it out on the site so that your citizens can know what the prices are. So they've been around ever since then. You notice the APCD Council is located in New Hampshire because New Hampshire was the one that really got it going. And so anyway, yeah.
So we have an example of the state that has successfully put medical and transparency costs on the website. So and people are complying with it. It seems to be successful. And we also have examples of how it can be done at council ready to do it. So this sounds like this bill would be very successful. Like do this.
Yeah, and the thing of it is it's very, very cheap to do this. That's the main thing that got me. I kept thinking, is this going to be something? I actually emailed. I've been having meetings with the New Hampshire Department of Insurance on this. Like, seriously, how do you do this? And I said, tell me how this is going to cost, because you can't go to the legislature and say, hey, give me something that's going to cost public money. And they said the whole total cost would be this. And I went, you're kidding? That's it? And they were like, yeah. And so anyway, they were. I'm amazed at it, and I can't imagine there'd be anybody in the state of South Dakota that wouldn't go, yes, please keep me in the non-transparency, I'll never know what a true bill is state that we're in right now, and not go to this and go, oh, sure, because then they can shop like anything else.
Right. That seems to be a common theme, is that people receive bills for their medical procedures, and they have no idea what's coming. And it seems the bills never end, and how much is this going to cost? And we just don't know until everything settles.
Well, and even like if you get, let's say you get a good faith hospital, it gives you a good faith estimate. It may be a good faith estimate, but you don't know. What are they basing it on? See, that's why you need the Department of Insurance to do it, because they already get the claims data. By law, they have to get the claims data because they want to make sure nobody's being fraudulent or whatever.
Sure.
So when they collate it and they put out an average cost per medical coded item, that's our actual market price. The thing that we should have had, 80 years ago, Dave, when we had the federal McCarran-Ferguson Act. They didn't. Those two senators aren't with us anymore. It was a World War II thing that they did that, but did they mean to create it? But they did. And so we're going to have to kind of go state by state, and this is our state's chance.
This sounds very doable. I think this is going to be brought this session.
Oh, yeah, it's going to be brought this session. And I can tell you this, from the legislators I've talked to, and there are a wide range of ones, both veteran and new members, and they're like, well, yeah, it's a
no-brainer.
Essentially, yeah.
Aaron, thank you for being with us this afternoon here at Dunn Brothers keep us informed about how this is going. When we receive the bill number, we shall get behind it.
Sure will. Thank you, Dave.
Thank you. This has been the Making Waves podcast. I'm in with Aaron Levisay to talk about medical cost transparency.